Welcome back to Thrani, I'm Joe B. Say goodbye to anterior rib pain for good with these simple yet effective techniques and exercises. Let's dive in. An anterior rib dysfunction is when the rib is stuck forward or anteriorly as compared to the rest of the ribs. The cause of this can be due to hypermobility of the costal cartilage or trauma, like when starting a push mower. An anterior rib can bring about a localized dull aching pain on the chest, increased by deep breathing. There is also a prominence of that dysfunctional rib at the chest. The assessment for an anterior rib dysfunction requires the PT to do an anterior rib sweep. Patient is in an erect, relaxed, short sitting position with arms at sides. The therapist is in front of the patient with the index and middle fingers 2 finger breadths lateral to the sternum. The palpating fingers are slowly slid from the upper second rib to the lowermost rib 6 to 7. Normal findings are that the ribs are of normal, similar prominence on either side of the sternum. Abnormal findings is that the rib will be prominent forward or anteriorly. For the treatment, a compression of that rib can be done in supine with the therapist's pisiform bone reinforced by the non-dominant hand, but may be too aggressive to start. So a muscle energy technique can be done in an effort to pull that rib laterally to distract the anterior aspect of the rib to reduce anterior displacement. Patient will be in short sitting with the right hand at the left shoulder. The therapist is behind the patient and to the left. The left hand holds the right elbow, while the right thumb is on the left shaft of the 5th rib, medial to the rib angle, and the medial aspect of the index finger, also on the 5th rib shaft. The therapist lifts the elbow to localize the force on the 5th rib, then instruct the patient to move the right elbow laterally against resistance or match the resistance of the therapist, while the right hand provides a posterolateral pull force on the rib shaft. The position is held for 6 seconds hold for 5 reps. The patient's left fist or pisiform bone can also be placed anteriorly on the 5th rib to provide a front to back force to assist with posterior rib movement. For the exercises, using a tennis ball pressed by the right and left hand to the anterior rib can be performed gently for 30 seconds times 3 reps, and can then progress to standing in front of the wall or in prone. So do you want to know how to correct the posterior rib? If so, then watch this next video. Thank you so much. If you like this video, please like, share, and comment. And for more therapy animations, please subscribe to Thrani.